Welcome to MedHeads, the podcast where we tackle the big health issues shaping our world. And today we're focusing on a topic that's both urgent and universal: youth mental health. While we'll spotlight the challenges here in Australia, we'll also zoom out to explore how young people around the globe are coping and how different countries are addressing this growing crisis. From the bush to bustling cities, and from the UK to the US, the mental health of our young people is a shared concern, and one we all have a role in solving. Let's start with the global picture. Around the world, young people are struggling. In England, 1 in 5 children and young adults are affected by mental health challenges, with issues like anxiety and depression starting as young as age 7. The US is seeing a similar trend. After the 2024 presidential election, calls to crisis hotlines like the Trevor Project skyrocketed by 700%, particularly from LGBTQ+ youth. Meanwhile, in countries like Poland, studies highlight the protective power of resilience, showing that young people with strong coping skills are better equipped to navigate life's challenges. And here in Australia, nearly 1 in 7 young people aged 4 to 17 faces a mental health challenge every year, with rural communities and Indigenous youth disproportionately affected. No matter where you look, the story is the same. Our young people are crying out for help. The question is, how do we answer? Let's bring it home. Australia has its own unique challenges. Suicide remains the leading cause of death for Australians aged 15 to 24. In rural areas, limited access to mental health professionals makes it even harder for kids to get help. For Indigenous youth, intergenerational trauma and systemic inequities create additional barriers. And then there's the digital divide. While online tools like Kids Helpline and Reach Out are life-saving for many, they're out of reach for families without reliable internet or devices. But Australia is also home to incredible solutions. Programs like Headspace and Be You are leading the charge in providing mental health support and resilience-building resources for young people. And culturally sensitive initiatives for Indigenous youth are combining traditional practices with modern therapies, creating meaningful, trusted care. What can we learn from other countries? California's innovative Soluna and Bright Life Kids programs provide free digital mental health support to millions of young people. These tools meet kids where they are, on their phones, and offer confidential, culturally relevant care. In the UK, there's growing debate about whether resilience training in schools could help ease the burden on mental health services. While critics worry about oversimplifying the issue, others see it as a way to empower young people before their struggles escalate into crises. The common thread across the world is that early intervention works. Whether it's digital tools, school programs, or community initiatives, the sooner we step in, the better the outcomes. So, how do we help kids thrive here in Australia and globally? The answer lies in a mix of strategies. Investing in early support. Programs like Be You teach resilience and emotional intelligence from a young age. Closing gaps in access. Whether through telehealth or expanded in-person services, we need to ensure every young person can get help, no matter where they live. Culturally inclusive care. For Indigenous youth, that means respecting culture and integrating it into care. For LGBTQ+ youth, it means creating safe, stigma-free spaces to seek support. Breaking stigma, normalizing conversations about mental health is key to helping young people feel safe asking for help. These aren't just ideas, they're investments in our future. Imagine a world where every young person, no matter where they are or what challenges they face, feels supported and valued. If you're wondering how you can make a difference, start with a simple conversation. Ask the young people in your life how they're doing, and really listen. Support programs like Headspace, advocate for more funding in mental health care, and challenge stigma in your community. The challenges may be big, but so is our ability to create change. Together, we can help kids not just survive, but thrive, here in Australia and across the globe. Thanks for joining me on this episode of MedHeads. If you want to dive deeper into today's topic or access resources for health professionals, visit meducate.com.au. Don't forget to subscribe, leave a review, and share this episode with someone who cares about the well-being of young people. Until next time, take care. Stay kind, and let's keep working to help kids thrive.